Welcome everyone to another special IDEAChatCNY. My name is Tony Kershaw and I'm the Assistant Director of IDEA at Syracuse University. Today we are in the Maxwell School for Citizenship and Public Affairs. IDEA and the Citizenship and Civic Engagement Program bring you a social entrepreneur, Lauren Braun, President and founder of Alma Sana, a growing healthcare startup seeking to improve the vaccination process for children and their families worldwide. The title of today's special web event is Social Innovation for Social Good. In the past, we've covered topics related to startups, tech, design, and media, but today we will be diving into what it means to be a social entrepreneur and how you can take steps to be one or think like one. Before we bring on our guest, Lauren, I want to invite you all to use the hashtag StartSU on Twitter to send in questions or comments. You can also submit questions by hitting the blue question button or simply commenting in the live feed on the right. Make sure you tag IDEAChatCNY and Maxwell SU so we can see those comments and put them on the air, okay? So, a little bit about Lauren. Lauren graduated from Cornell in 2011 with a BS in Human Development and 2 minors in Inequality and Global Health. During a summer internship in Peru and with help from her moms and nurses she worked with there, Lauren developed a vaccine reminder bracelet to help mothers remember their children's vaccination appointments. In 2012, Lauren launched a 501c3 nonprofit social enterprise called Alma Sana Incorporated, which received a $100,000 grant from the Bill and Melinda Gates Foundation to test the use of the bracelets, in Peru and Ecuador. To pursue Alma Sana full-time, she quit her corporate job at a Fortune 100 health insurance company. Over the past year, Lauren hired a team of 19 people, established relationships with the ministries of health in Peru and Ecuador, and implemented the 6-month pilot project. She and her team are now analyzing the results and are planning to apply to a follow-up grant from the Gates Foundation to receive up to $1 million to scale up the project over the next 2 years. Lauren recently gave a TED Talk at Cornell U about developing the bracelets in Alma Sana, and she was nominated for Forbes magazine's 30 Under 30 Social Entrepreneur 2014 list. Alma Sana is also the nominee for the Classy Awards, the largest award ceremony for social impact in the United States. Lauren is currently living in Berlin, Germany, so we want to thank her for her time today until she starts her master's in public health this fall. Ooh, I know that was a lot. That's a pretty heavy resume there. So without further ado, let's meet Lauren. How are you, Lauren?
I'm great. How are you doing, Tony?
I am fantastic. I'm a little out of breath because you have so many awards, so many accolades. We're really, really honored to have you here today.
Well, thanks. It's great to be here, and I'm really looking forward to hopefully sharing a little bit of what I've learned through this process with all of your students. So I'm really excited to be here.
Tell us your story. Tell us the Alma Sana story.
So I think if everyone could pull up the PowerPoint presentation, I think it's a very visual story, so I think that would be the best way we could walk through this. So this is, and I have an actual bracelet with me here. I don't know if you can all see this, but this is the actual bracelets that we've just finished testing in the field, and to be honest, my bio was a pretty good summary of where we've come. But basically, yeah, I came up with the idea after during a summer internship after my sophomore year. I spent the summer in Cusco, Peru, and worked at a public health clinic. Every day I worked with these nurses, and part of my job was to go up into these mountains every day and look for moms door to door with these nurses, and it was just very inefficient. It took up to 4 hours a day, and the tough part was, because these were government-run clinics, this is in a developing country, the clinics were overcrowded every day, so there were patients who would come literally 6, 7 in the morning and wait all day to see a nurse and for themselves or for their child, and so it was just a very inefficient process, so they weren't able to see those patients. And I just got to talking to the nurses and the moms and just asked them all about what their needs were and what kind of to learn all about the system, and did some of my own research. And then that's how I came up with the idea of using a bracelet as a vaccine reminder device. And so my last week that I was in Peru, I drew out a sketch of the bracelet, the original prototype, and showed it to the moms and nurses, and was like, do you think this would even help you? And they said, yes, this is exactly the kind of thing that would make our job so much easier, and it would help save these babies' lives. Because the thing is that the moms really wanted their kids to be vaccinated, and they knew that was important. They just didn't have a way to remind them that was conducive to their environment. And so I got back home from Peru and started working on the patent process, which is very expensive, and it takes several years to work through that. And so I also signed up for a number of different business classes and different competitions to try and hone my idea and have a concrete idea of how I would actually make this happen. And I talked to a number of different experts who were in all different sorts of industries: pharmaceutical industry, NGOs, people working out in the fields, doctors and nurses, and designers and engineers, just to get a sense of each of their different perspectives and how we could best make this bracelet and the implementation of the bracelet work for all these different parties potentially. So this, you can see here, this first slide is the final product, like I said, that we had in the field. And the way it works is each of the different symbols represents a different vaccine, and each of the different numbers represents the number of months after a child's born that they need those vaccines. So ideally, this would correspond to the child's age. So at 2 months, you can see they need 4 different vaccines. At 4 months, they need 4 vaccines. And at 6 months, you can see part of it on the side there. And if a shape repeats on the bracelet, it means they need multiple doses of that vaccine to be fully vaccinated, fully covered. And the way we indicate that is we have a 1/16 inch hole puncher, and we literally just take the bracelet off the baby. You can see on the next slide how this would work. The mom comes in with her baby. The nurse is going to give the baby all the shots she needs, and then she's going to take off the bracelet and hole punch out the center of each of those shapes and give it back to the baby. So that way the mom understands how many vaccines her kid's gotten, the types of vaccines the child's gotten, and also the dates of all the upcoming vaccine appointments. And so if you go to the next slide, slide 3, I just wanted to include this because it's an adorable baby that was too old to participate in our study, but she was so cute, and her mom really wanted her to participate, and she asked us, when is there any chance that we could be a part of this, in the future? And I said, our hope is that in the future, after this initial pilot study, we want all moms to be able to participate in this. So that was just a beautiful thing, and the baby just wouldn't let go of the bracelet. So it was a great thing to see that so many moms were really interested in this, and a lot of people were asking questions, can they participate? The next slide is a slide that it was a moment that I talk about a lot because it was one of the most remarkable experiences in my life. And this is the first mom who wanted to participate in our study, and it's the first baby to ever wear one of our bracelets. So for me, this was a 4-year process because after college, I didn't have any funding available, and so I went to work for a health insurance company. And the idea really stayed with me, though, and so I applied to this grant from the Gates Foundation just on a whim, and found out later on that I received the grant. So I quit my corporate job and began working on this full time, and it was about 8 months from the time I got the grant to the time that we handed out these bracelets to these moms. So when I handed out the bracelet to this mom, she said she really wanted to participate, and so I went over to her and knelt down and explained the bracelet and how it worked, and she repeated it back to me, so I knew she understood it. And you can see here she's putting on her baby's wrist, and for me it was one of those moments that I knew I had come full circle, because I had made a promise to these nurses 4 years before that I was going to bring these bracelets back. So it was just a really great experience, just coming full circle and making good on that promise, even though it took a little bit of time to get there. So that's sort of the story of how we got to where we are. The last page is just contact information for you all in case you want to reach out later. But it's been a great learning experience, and like Tony mentioned, we just finished our 6-month pilot study in Peru and Ecuador. We did 2 sites, one rural and one urban. And we're planning to apply to the follow-up grant in April, and we'll find out in September if we've gotten that grant. So it's kind of where we are right now.
So I actually have a couple of questions. So you said that you kind of started this whole project on a whim, but you really wrote a grant proposal, and it seemed like you were really intentional about trying to get this off the ground. So what fears did you have going into starting this project? Like, what kind of mindset did you have when you thought about really trying to essentially change the world for mothers all over the world?
You know, I think that's a great question. You're right. I should clarify. When I meant on a whim, by the time I got to the actual application for the Gates Foundation, I had already spent the last two and a half years writing grant proposals. So I had already entered into a handful of international and national business competitions, innovation competitions. I had already given my pitch multiple times to audiences of various sizes. So I was very comfortable with explaining my idea to all kinds of different audiences. So by the time I actually got to the Gates grant, I was really prepared and put the application together in about an hour, and I submitted it a couple minutes before the deadline, which I don't recommend for other people applying to grant funds. But yeah, I mean, I think throughout the whole process, my mindset was always I was always focused on the babies. And I think this is something that's really interesting because I think there's a huge advantage to coming, to starting a business or a social enterprise, having expertise in another area outside of business. Because when you're studying architecture, when you're studying health, or you're studying some very specific problem, you're going to learn so much about that problem because that's your expertise. And then, at the point where you find a solution to that and you want to implement it, then you have to go through the process of learning all the business skills that are going to help you be able to implement it. And I think that's really where there's an advantage, because when I was going through this, I never really was interested in business until I started this, but then I realized, I have to be able to build something around this, because no one else is going to invest time or money or anything or believe in this idea if I don't have a very clear way of telling people how I'm going to be able to do that.
Exactly. In the work that we do here at the school, most people realize that when they actually do go through the process, you do get so hung up on the things that you're learning in class, and you really want to dive down and know your stuff. But when you put that stuff into the context of the real world, business is really important. That's what makes the world go, right?
I agree, and I think that's where I think that I view business as a tool, and that's why I really think there was an advantage, because the reason I stayed with this project was because every day the last week I was there, after I told them about the idea, every day the nurses kept coming up to me and said, I talked to my husband about it last night, can you make the pink ones for girls and blue for boys, and can you make certain shapes indicate certain vaccines, and when can we use it? Every day they did that. And if they hadn't cared about this, there's no way I would have spent this much of my life working on it. But I think that's where, there's a real advantage. That's what motivated me throughout this whole thing.
Was that also what motivated you to quit your job? Because that's a pretty big step. I don't know if most people would do that.
Yeah, it's funny because my parents were more concerned about kind of the financial ramifications of that than I was. Naturally, I think, but I had been saving money from working there, and I had corporate benefits, some of which I, from saving my own money, was able to keep. And like the New York Times article this morning mentioned, because of Obamacare. At the time, I was 24, so I was able to go back onto my parents' health insurance, which I think was a great advantage. But yeah, I mean, yeah. I think it's good advantage to come from another area.
So my next question. You mentioned that this was a 501c3, but typically you don't, generally speaking, you don't refer to nonprofits as business or social enterprises. So could you explain what you mean by social enterprise? How is this different than a traditional nonprofit or an NGO?
Yeah, I think, and it's sort of a nuanced thing, right? Because in a sense, a social enterprise, a social business is a business of it doesn't matter what kind of what legal entity it is. It could be nonprofit, it could be for-profit, it could be a B Corp, it could be anything. The the way that I found a real definition for this the other day, the way the government classifies it. The Great Social Enterprise Consensus in 2012 said that there are hundreds of thousands of organizations that should self-classify as social enterprises, but they don't. So the way you tell a social enterprise from another business is three different things. One is what they do. So this is their definition. It said producing a good or a service to solve a social problem. Two is how they do it. So that's employing from, locating in, or buying from underserved communities as a primary purpose. And the third aspect is why they do it. So making profits for the main purpose of reinvesting it in a social activity. And so that's the difference with a traditional nonprofit is the nonprofit exists. It exists for a social good, but technical universities are nonprofits too. I mean, the definition of nonprofit is so broad in the States, and but I think the real key with the social enterprise is it's trying to be more sustainable in a way, because some of you might be familiar with Warby Parker. It's a company based out of New York, or Tom's Shoes. Those are true social enterprises because they exist to sell glasses and to sell shoes, but the reason that they exist is to be able to donate a pair of glasses or a pair of shoes to someone in need in a developing country, and that is their business model, the one-for-one. So it's just sort of a nuance. It's sort of the reason that the organization exists, or the way it's set up, or the good that they produce.
Gotcha. Okay, so one last question from me, and then we'll open it up to our audience. And just as a quick reminder for those watching online, feel free to submit questions on Twitter or submit questions in the live chat feed on the right. So, okay, so my last question. What skills do you feel you rely on the most in your line of work? You kind of touched on some skills, but for the students that are going to be watching this, all over the world, what specific skills do you recommend that they develop or maybe learn to kind of get into the work that you're doing?
Hands down, the single most important skill is people skills. And I think it can be kind of squishy because, there's, what does that mean? To be honest, if you're going to be starting your own social enterprise, you have an idea for something, you have to be able to get other people inspired and get why should other people believe in your idea? And that really comes from you sort of being your own cheerleader and having the evidence to back it up of why this is worth investing in. And I think, for the first couple years, but even now too, every opportunity I had, I sort of developed a reputation, sort of a brand around this project. And so people were like, when people knew about vaccine things going on or innovative devices, they knew to reach out to me. They knew to reach out to me about that because that was sort of my thing. So, it could be, you're at a party and people are like, yeah, so what are you up to? And then you say, oh, well, I'm actually working on this project, and come up with an elevator pitch. And it doesn't need to be that formal, but it's just something quick that tells people what you're doing, why you're doing it, and how you're planning to do it. And I think the key also is to tell people, people like very specific things. So if you know you need a graphic designer, then that should be what everyone you meet, you should say, yeah, I'm doing this project, and actually, yeah, I'm looking for a graphic designer. Maybe you know of anyone? So you've already told them what you're looking for. You've told them, exactly, you've told them, what your needs are, and then that gives people a very specific, clear thing that they know to help you with. And that's going to evolve, throughout the course of your project. So my last 2 years of college, I was really focusing on honing the design for the bracelet. And so I met with a lot of engineer students and designers, right? And I just reached out to all kinds of people and was like, what's your take on this? How would you design this? And just talk through that. Another skill I think is really important, and I think, a lot of different roles use this, is project management. I know, especially in my field in global health, a lot of the roles that, in particular, young people work in are field experience roles. So it's managing projects on site in the ground. Yeah, exactly. So being on the ground and managing projects, and that's something I had a lot of experience in from my previous role. I managed 4 different health programs that were internally within our company, and our company had about 40,000 associates, and the programs I managed touched almost all those people. So, you know, being on time, staying organized, being able to follow up with people. I still find it kind of surprising sometimes that you know, you go to an event and, you know, it's supposedly a conference or the networking event. You know, what does that mean? I mean, your goal should be to talk to as many people as you can, give them your quick elevator pitch, be interested in what they're doing, and, you know, just learn about how you can help them. But being able to manage projects and follow up with people afterwards. So I don't know, those are the two main skills. I would say people skills and project management, because I think you need both of those to do anything, especially starting a business.
Right. So we're going to take this time now to answer some questions from our live audience, and then we're going to field some questions from our virtual audience. So, you have a question? Yeah. Okay. So tell us your name, what you're studying, and then your question.
My name is Emily Scardella. I'm studying international relations and hopefully policy studies. I was just wondering where the name Alma Sana came from.
Alma Sana in Spanish means healthy soul. And so it alludes to the idea that when the mind and the body are healthy, so is the soul.
Another question? Yeah.
Hi, my name's Julia Jones. I'm an international relations major and entrepreneurship. I am wondering if you're looking to branch out to other countries, other continents with this project.
Definitely. Yeah, so the way that, this is the kind of interesting thing with Alma Sana, because we're not a traditional, even social enterprise, you could say, because we're going at it from a very specific perspective. We exist initially right now solely to test it. So it's basically an organization built around a research study. So we just finished our 6-month pilot, like I said, and so now what we're doing is writing up all the results, and we're analyzing them and preparing for this next grant. But in the interim, we have no one on the ground, no one on site anymore, because the testing sort of phase is done. If when we scale up, we're going to do a larger study. It's going to have a control group, and it's going to be on a bigger scale in Peru and Ecuador. And we'd also like to do an additional pilot, either somewhere in Africa or Southeast Asia. And so, because the thing is, you know, this, even though it's not a drug or something that's going into people's bodies, it's an intervention. And anytime you have an intervention that's new, you don't know if it's going to work. So what we're trying to do right now is build up evidence to show that this actually does work. So this first round was showing, you know, we explained to moms how to use the bracelet, what do you do with it, and then we tracked all their feedback, and we tracked their behavior, and we tracked their baby's vaccine record. So that's sort of like the behavioral piece. And since moms seem to really like using the bracelet as a vaccine reminder device, and so did the nurses, this next round, what we're going to do is actually look to see, does it work? So we're going to actually look for the efficacy of the bracelet this round. And then that way, after this round, or probably during this round, we can start approaching larger organizations and say, you know, we've got some serious evidence that shows that this thing is actually working. And then at that point, you know, a bigger organization like a PATH or a pharmaceutical company would step in, and then they could invest in this. Because those are the kind of organizations that have all the manpower you need to get into more countries and really be able to scale it up. They've also got all the distribution channels. So that's kind of how the path that we're on right now.
Sweet. So, another question from our audience? Go ahead.
I have actually two related questions. I'm Paul Hagenlow. I'm the chair of the Citizenship and Civic Engagement program at Maxwell. So the striking thing about the story is how young you were when you started it, right? You're a college sophomore, you get this idea. And I wanted to ask you, if, in retrospect, do you think that the detour into the, you know, the corporate insurance world was a necessary part of it? Could you have done it without that detour? Could you have graduated from college and jumped right into it and made it work? Or do you think that part of the experience wasn't necessary, you know, part of the whole? And then the other half of the question is, as a college junior and a senior, looking back, were there parts of your experience at Cornell were particularly important to bring you to this, you know, to this path and giving you these skills? Was there a part of college that you look back on and say, I could not have done it without that?
Yes, let me answer your second question first. I just jotted these down. My experience at Cornell was transformative in a number of ways. I started out as a pre-med, like many of us in public health do, because we don't know what else is out there. And I knew that I wanted to help people improve their health so that they could lead healthier lives. In my sophomore years, it was actually the second year that they introduced the Cornell Global Health minor. So it was a fairly new program, but I was reading through the course list and I was just so inspired by the scale of the program. I mean, you know, because it would allow me to help people on a broader scale. I could, instead of in one day, I could see 15 patients, or I could help 15,000 people by, you know, passing this policy or managing this program that would touch all of them. So it also played more to my strengths. But something that really made a huge impact on me personally going through this project was something that the program really focuses on is and I don't even know if they realize this going through this, because it's basically human-centered design is what they taught us. So one of the things we learned was we looked at different case studies that showed all these failed interventions over the past 50 years in global health. And why did they all fail? Well, because, you know, we're very educated and we go to these countries and we see they're not educated, and then we design things that are super technologically advanced, expensive maybe, really high tech, and then we just throw it in there without ever asking the people if it would help them or if they even needed it. And that was something that just really stuck with me, because I think in the for-profit world, this is the first step of the whole process. And it just blew my mind that didn't carry over to the nonprofit world. You know, technically, whether or not they're paying to use our products, they are our customers. So why wouldn't we incorporate their feedback into the design? So that it just really stuck with me, because all these resources are being poured in. And so I thought, you know, why wouldn't you ask them? So then when I got to Peru, I just asked a lot of questions and was just so frustrated having to spend all this time. And the more I learned about it, you know, the nurses were wasting time, and also the government ended up wasting a lot of money because they had to purchase vaccines twice because of their delivery system. So it was just sort of a losing situation for all three groups. And that's just when I thought, you know, there's got to be some simple thing. So I think just that, learning that at Cornell, putting your customer, so to speak, first, and designing around their needs. And you know, it's funny because this is Silicon, right? It's like everyone always asked me what the technology was, and I was like, you don't want it to be complicated. And so that was really transformative. And I'll quickly also say that design thinking has been really influential to me. IDEO and Frog Design, but especially IDEO, I saw them speak a couple times when I was an undergrad, and they talked exactly about this. I mean, they're so well known for this, but they have this whole dynamic process where they design, they learn all about the problem from the users, they experience it with the user, and then they design a solution with them to come up with something that actually fits their needs. And it's an iterative process. So I just thought it made so much sense, and it really inspired me in designing this. To answer your first question, was it necessary to go corporate? You know, it's funny because I'm more of like I was really interested in working for strictly global health organizations, because my passion lies in the global sphere, not as much in the domestic sphere. But I think that looking back, my experiences there really helped me so much in many ways with Alma Sana, because I didn't know that I was good at project management until I got there, and I was given more and more programs, and I realized, you know, maybe compared to other people around me, I was like, well, I'm very organized. I get things done on time. I'm very good at working with a lot of stakeholders. And brought a lot of rigor to our programs that we didn't have before. So I had a lot more data measurements around those. And so I think I had more confidence going into Alma Sana, because I was like, I've already done this, so to speak. I've added organization to in an environment that was not as clear. So yeah, although I wish I had gone right after undergrad, I think having that experience was really invaluable for Alma Sana.
Nice. So we have another question from a student. So give us your name, your major, and your question.
I'm Amy Young, a freshman major in sociology. Like when you mentioned that you want to make sure the bracelet work before you want to spread your product, can you give us some specific example? Like what's the challenge you face with when you deliver the bracelet, and how can you recognize it and to solve it.
I'm sorry, that cut out a little bit. Could you say that one more time?
Sure. So she asked, when you were starting to implement the bracelets, what challenges did you face? You know, were there issues with the mothers? You know, how was that interaction? And how did you solve those problems?
With implementing, well, I will say it wasn't so much with the moms as it was with the nurses, because research studies are common, I guess, like in developing countries, but the biggest challenge was getting the nurses on our side, because they were going to be our partners throughout this whole process. And it had been, like I said, 4 years since I was there, so I didn't even know if the problem still was as bad as when I was first there. I didn't know if they would remember me, if they would, you know, even think it was useful still. And so our challenge was, we got down there a little bit early. I got down there with a couple other team members and went to there were 7 clinics in Peru that said they wanted to participate. We ended up going with 2. And visited 2 or 3 clinics and just talked to them and sort of basically pitched the idea again. So we had their written permission, like in a contract before we got there, just due to some other connections we had on the ground that helped facilitate that. But getting there in person, it's very much a relationship-based culture. So you really have to show up in person and spend a lot of time with them, getting to know them, and and so we even got their feedback with this. So we were able to tweak the design of one of our other materials based on the nurses' feedback before we even started, which was great. So it was so great because the first week we had pitched to the nurses. The head doctor at our larger clinic was so excited about this. He called all the nurses around the hospital into our room to watch and had me re-explain the whole thing to them. And I brought a ton of these so they could hold it, they could pass it around, they could see how the hole punch worked. And it just made their support, they were thinking about it, they were asking a lot of questions about it, and their support was the support we really needed to be able to do this. And so during the whole first month of enrollment, we were getting moms in the study, and every day the head nurse went out to the waiting room. We didn't ask her to, and she made announcements every day that, Alma Sana is here, they're doing this study, we think these bracelets can really help save your baby's lives, we encourage you to participate. And it was a very positive experience for them, and they didn't have to. And I think it really helped. And another thing I think from the mom's perspective was incorporating the dads into the process. And so we had a picture of a mom and a dad looking at the bracelet, and then both of them coming to the clinic. And then it really, because we had a couple dads who wanted to learn more before they wanted their wife and baby to participate. So just sort of things like that, cultural nuances you just have to be aware of.
So now we're going to take a question from our virtual audience. You touched a little bit on, working with others, the nurses, the moms. Who else did you work with?
That was it. That's all we went straight to the source. I did consider working with like an internship kind of organization who I went with, but they were going to charge 3 times as much for our interns to participate, and I was like, I'll just do it myself for a lot cheaper, and it was going to be unpaid either way, So having gone through that myself, I knew that could be a huge financial burden for people who were coming down to help out. So I didn't want them to have to pay more than they needed to. So they basically just covered all their living costs. We didn't have any program fee or anything, and found housing for them. And so we just worked directly with the Ministry of Health of each country, and that was both at the clinic level and at the regional level in both countries. And we kept them updated on everything throughout the project.
Oh, sweet. Okay, so I don't know if we have any more questions from our audience, so I'm just going to solicit one more time. If you have any questions, feel free to submit them now. We are going to get one more question from our audience. I'm just trying to give them a little bit more time to think of one, because you answer multiple questions every time we ask you one. So yeah, if you want to submit a question, you can submit a question in the live chat on the right, submit one on Twitter. Okay, we have a question.
What's the next project once you get this up and running? What's the next big project?
That's a good question. I'm looking for it. I'm in Berlin, like I said, I'm in Berlin now and for a few months, and it's a very different environment here. It's very tech focused, which is sort of new to me in a business sense, but I've just been meeting a lot of entrepreneurs and people who are, both at that point where they're looking for funding or they're developing ideas and brainstorming, and people who have already gotten funding. So there's a whole range of like where people are in the process, and because at the same time I'm looking for a way to develop a business plan around Alma Sana that's more sustainable, but in the meantime, I'm trying to learn that by getting involved in some of these other organizations. So I informally consult a number of people who are trying to build businesses all over the world right now, just sort of on like in a mentorship kind of a capacity. But I'm trying to get a different cultural perspective on it and find a project I'm passionate about here where I can help in the meantime before I start grad school.
Great. So, in the interest of time, what advice would you give to aspiring entrepreneurs or those who are interested in being entrepreneurial in the corporate world?
Those are two questions in there. I have a lot of respect for people who can change organizations from within, because it is so challenging, and I got a taste of that in my corporate experience, and I think it's the same type of skills that you need, putting yourself in other people's shoes, but I think that the politics can be much more, it's a much bigger barrier there than whereas if you're starting on your own, then you can sort of pick and choose a little bit more. I think there's fewer barriers to do outside, but yeah, huge respect for people who can change corporations from within. If you are thinking about starting a company, I would say just do it. I never thought I would be an entrepreneur. It was never something I was even interested in. I only founded Alma Sana because, the time I graduated, we didn't have any other funding opportunities, and I had been applying to jobs. But I had approached so many different organizations, and they were all really interested. But they said, come back when you've shown that it works. And so I realized that if I really wanted to do this, I was going to have to go out on my own to test it. And so I think if you're going to do it, but do it smartly. Make sure that you do your research, and you should be able to answer any question that anyone asks you about your business, who your competitors are, how you're going to market it, what you need from other people. Have you talked to people about what they actually want in your product? What's your timeline? How much funding do you need? You should be you should be the expert on all that stuff. And so do your research. Also get great mentors, especially if you're a college student. I've met people who are around my age or older, or a lot older, who are trying to start companies. And to me, it's not as much about your age as it is the experience you have. So build a network of people around you who are genuinely interested in your project and genuinely interested in the work that you're doing and your success, and also have a lot to teach you. I've learned so much in this whole process from having great legal counsel, which is really important, great counsel about how to even do a research study, and just bootstrap. I mean, teach yourself marketing. Honestly, you don't need a $100,000 budget for marketing. Just teach yourself how to write a tweet, and don't ask for funding too soon. And we're really fortunate because we haven't had to ask for any funding in the whole time that we've been doing this, because this grant, we've gotten this project done under budget, and it's just been great. So just do your research, find great mentors, and then just do it. That's what I recommend.
Awesome. Lauren, thank you so much for taking the time to talk to us and all of our viewers online today. I think you dropped a lot of knowledge on us, and I hope now for those of us that are interested in possibly pursuing opportunities in social entrepreneurship, or really just maybe taking a look at exploring what entrepreneurship might mean for their careers, I think you really opened up the door for them today. So thank you again so much for your time.
Sure, thank you so much. And seriously, if anyone, I'm happy to talk to anyone offline if you have any questions or you want to learn more. I'm happy to help you out in any way I can. So feel free to reach out.
Much, Lauren. We'll see you.
All right, thanks a lot. All right, bye.
Bye. So that wraps another IDEAChatCNY. Follow Alma Sana's progress on Twitter at Alma Sana Project. You can also reach them on Facebook, LinkedIn, and you can visit their website to get updates on their project as they move forward, analyzing the data that they collected over this 6-month pilot project. If you'd like to learn more about Lauren's journey, you can watch her TED Talk on YouTube, and you can read about how Obamacare helped Lauren move her business forward. We will provide that link as well. You can keep the conversation going on Twitter using the hashtag StartSU, and make sure that you tag IDEACHUS and Maxwell SU when you submit a comment. If you missed part of the talk or want to share the experience with friends, you can visit our virtual studio and check this out and all the other chats we've had on our website. On behalf of Maxwell, IDEA, and all of our viewers, I want to thank Lauren for her time and best wishes on the next stage of building Alma Sana. Take care, everyone.